somewhere over a transverse process. So the setup position-wise, and these are hard to show. So we establish a neck movement that's a little bit tight, so just do flexion and extension for us. Yeah, not amazing flexion, it's terrible flexion, right? Yeah. Yeah, all right, cool. We'll just use flexion. So this is a midline technique because it's a midline movement, right? So try and marry those things. If she felt it all pull down the left-hand side, then obviously I'd be thinking about mobilizing the left. But if she just feels that's tight, first place I'm going to try is the middle. So my contact is basically going to be over a spinous process. An awful lot of neck things boil down to C5-6, so it's usually that. If you poke on C5-6 and it doesn't work, try a different C5-6. It's not my joke. Thank you, Jeremy Lewis. Okay, so basically what I want to do is just flex the head just a little bit till I feel like I'm getting some opening around the section that I'm interested in. And I'm going to go kind of mid-cervical here, so sort of around 4-5-ish, this area here. Landmarks to know, C7 is the big lump at the bottom, C2 is the big lump at the top, the bit in between is your neck. And if you want to claim you know which one's C4 and 5, then go, but I don't claim to know those things. All I know is that what I'm looking for is to just open a vertebrae segment, hook under a spinous process, and now I'm going to do that with this hand, right? So I'm holding there, I'm going to put the, I'm nestling the head against my side, trying not to move it out of midline, but giving her something to lean on, and taking a little bit of weight out the head, and then I mobilize. It's super gentle. Wear deodorant. It's not that bad, is it? Because her face is straight out. What you don't want to do is end up right across their face with it. So you kind of put your armpit over the top of their head, essentially. Into that position, cuddle in. Central technique would be this, usually 20, 30 seconds, grade 3.
You go in it?
I'm aiming at the back of the ear, like on that angle. So if I'm high up here, my pressure is pretty much straight in. If I'm low down, it becomes increasingly a vertical lift. Okay, but it's up, up and in. All aiming here. So whichever facet joint you're on, if you aim at the ear and the eye line, you're roughly on facet plane. Except for anatomical variants, which are out there, and some people you can really feel it. That just isn't like that. That does go straight forward, or